So guys, welcome to part 3 of our arterial blood gas. So we did mention that the things that your blood gas machine is going to analyze for you is the pH, is going to be the partial pressure of carbon dioxide, is going to be your bicarbonate. I want us to talk about the bicarbonate now. I haven't said a lot about bicarbonate simply because I wanted to try and make this as simple as possible. So now that we know about the pH and we know about the partial pressure of CO2, now let's talk about the bicarbonate. And I really want us to go together on this thing, guys. So once again, I'll say you get what is this thing? A strip, a result, ABG results from the machine. First thing you look at is the pH. Decide if your pH is acidic or is alkaline. I want to bring bicarbonate into this one now. So we said this is your number one. Look at the pH. Number two, look at the partial pressure of CO2. You do this for both sides, right? And then if your partial pressure of CO2 is high or if it's low, if the partial pressure of CO2 is high and you have got acidosis, then that's respiratory acidosis. Like I explained on part 2 of this video, that once you've got a lot of CO2 in the body, that CO2 combines with water to form carbonic acid and then you get acidosis. So this is respiratory acidosis, right? I want to bring in bicarbonate now. So in the event where you look at the pH of a patient and you discover that it's acidotic, then the partial pressure is low, then it means that, like I said on the previous video, that if you have got acidosis, if this acidosis must be emanating from a respiratory point of view, then our CO2 must be high. So we don't have a problem here. We've got an acidosis, an acidic pH with an increased partial pressure of carbon dioxide. We are happy. There's nothing confusing there because our CO2 agrees with an acidic pH. Remember, like I said, an increased partial pressure of CO2, meaning the patient is building up CO2 in the body, that will cause acidosis. So acidosis plus an increased CO2, that gives you respiratory acidosis. But look at this one. You have acidosis, but you've got a decreased CO2. We know that a decreased CO2 doesn't give us acidosis, but it gives us alkalosis. It gives us alkalosis. That's a decreased CO2, meaning a CO2 that is less than 35. This is a decreased CO2 giving us alkalosis, but we don't have alkalosis in this patient, we have acidosis. So which means that this is not the cause of this. It only makes sense that this cannot be a cause of this. So which means if we have acidosis in the body, if our pH is acidotic but we've got a decreased CO2. Remember, these are two different patients. This is a patient who's got a pH that is low, an acidic pH, but an increased CO2 in the blood. Easy to diagnose, respiratory acidosis. But this patient has got acidosis, but the partial pressure of CO2 is pointing towards the alkalotic side. So, which means this patient, this acidosis is not due to this partial. It has got nothing to do with this low partial pressure, because we know that a low partial pressure gives us alkalosis, which is the case here. So we have alkalosis here. So which means this is not the primary problem. For this patient, this is just compensating. So this patient has got the initial insult here is acidosis, which is metabolic acidosis. So the diagnosis here is metabolic acidosis. Metabolic acidosis. Because we know that you cannot have an acidotic pH if the primary problem is alkalosis. I don't know if you get what I'm trying to say, guys. I don't want to overemphasize it and I end up losing it myself, like saying things that are not true. What I'm saying is we have an acidic pH. We know that we've got acidosis. But now when we look at our partial pressure is telling us about alkalosis. This is an alkalotic partial pressure of CO2, but we don't have this. This is what we have. We've got acidosis. So which means the primary problem, this is just compensating. So the primary insult is this. So this one is just compensating. So what do? Check your bicarbs in this case. Check your bicarbs. Look at your bicarbs. In this case, you should have bicarbs that are less than 21 or less than 22. Some books, some say less than 21. So your bicarbs should be around 11, 12, 13. So which means now you should be having low bicarbs in this patient, because remember the CO2, because remember in this patient you say that this patient is acidotic, and you say that the acidosis is most likely metabolic, because this doesn't tally with this. So now to confirm that really it's metabolic, look at your bicarbs, because when you've got high bicarbs, it means you've got alkalosis. But if you've got decreased bicarbs, it means you've got acidosis. So when you've got CO3 like this, if you've got a lot of these, your body is alkalotic, and the alkalosis is metabolic. Just because this is one that is high, it's metabolic. But if you have got a respiratory alkalosis, you've got a decreased partial pressure of CO2. So that's a difference. So sorry. So in this case, we are saying that we've got an acidic patient. pH is acidic. But we look here, we see alkalosis according to the partial pressure of CO2. So it means the initial insult must be an acidic kind of an insult. So it makes sense that it's metabolic acidosis. But now, to confirm that, look at your CO2. If your CO2 is, you've got decreased CO2, bicarbonate, look at your bicarbonate. Not CO2, but bicarbonate. Look at your bicarbonate. If your bicarbonates, they are very severely low, it means really what you are having there, you've got metabolic acidosis. I hope you get that. Let's come to this other side. So in this other side, you've got an alkaline pH. Your pH is alkaline, like that. You've got an alkaline pH, and then the step 2, like here, step 2, Look at partial pressure of CO2. What is it doing? If your partial pressure of CO2 is low, let's say it's high this side. So a low partial pressure of CO2, which is less than 35, that's alkalosis. It gives us an alkalotic pH. And a partial pressure of CO2 that is low, less than 35, is an alkaline. It gives us an alkalotic pH. And this alkalotic pH agrees with our pH. This alkalotic picture of the CO2, a partial pressure of CO2 that is high, it's an acidic picture. A partial pressure of CO2 that is low is an alkalotic picture. So what I'm saying here, you've got your main problem is alkalinity or alkalosis. Now you look at your partial pressure of CO2 and decide what is it doing. So you see, okay, we know that a low CO2 gives us alkalinity, and this alkalinity agrees with this pH. So this patient must be having a respiratory alkalosis, this patient. But look at the opposite side. We've got a patient that has got an alkaline pH, but the CO2 here is more than 45 because it's high. It's more than 45. And we know that a CO2 that is more than 45 is an acidic picture. It's respiratory acidosis. But the problem that we have, we've got alkalinity. We don't have a problem of, in this patient, we don't have a problem of acidosis, but we've got a problem of alkalinity. So because this does not go well with this, they don't tally together. So the only other reason must be a metabolic alkalosis. Look at your bicarbs to confirm that these bicarbs must be high. These bicarbs must be high, greater than 27 or 26, some books. Then now you can diagnose the problem there. Don't know if I should do this thing again and explain it. I don't know. Let me try one more time. Let me try one more time because I really want you guys to get this. So we're saying you look at the pH, number one. pH is acidic. pH is alkaline. Happy? Okay. So that's step one. Step one. We know that we've got acidosis here. We've got alkalinity here. So let's decide now, is it respiratory? Is it metabolic? So what do we do? The next thing that we do, look at PCO2. PCO2 that is high, meaning more than 45, it gives us acidosis. PCO2 that is less than 35, it gives us alkalosis, right? Bicarbs that are high gives us metabolic alkalosis. Bicarbs that are low, they become so low that the only thing that we have now is hydrogen ions, which causes metabolic acidosis. Okay, so we come here, we say partial pressure of our CO2 in this patient. Remember, these are two different patients. This patient has got an alkaline pH with a partial pressure of CO2 that is more than 45. Then this another patient now. Actually, this pathway is for two patients. Ne? We've got a patient that has got an alkaline pH with that patient number one has got an alkaline pH with partial pressure of CO2 that is more than 45. The second patient has got an alkaline pH with a partial pressure of CO2 that is less than 35, right? These are two. This is patient 1, this is patient 2. Different scenarios. Okay, so the patient, let's start with this one. So this patient has got an alkaline pH. Then we look at the CO2. The CO2 is 45. So the CO2 does not agree with this alkalinity, which means that the pH is alkaline, but we know that a high concentration of CO2 gives us acidosis. So this is an acidic picture of CO2, which does not tally with this. So which means the alkalinity is not related to the PCO2. So we can by default say this patient has got a metabolic alkalosis, because there's no other option, right? So to confirm that, look at your CO2. I mean your HCO3, which is bicarbs. Your bicarbs in this alkaline patient, if they've got metabolic alkalosis, that bicarb should be high. That's patient number 1. Patient number 2 is a patient who's got an alkaline pH, but their partial pressure of CO2 is less than 35. So this, we know that when you hyperventilate, you take out the CO2, so which means you cannot be forming an acid that will counter the alkalosis. So you develop alkalosis. So this patient has got alkalosis according to this picture. Alkalosis. So this alkalosis does agree with this alkalosis. So this kind of partial pressure of CO2 that is less than 35 is an alkaline picture of the partial pressure of CO2. It agrees with this. So we can say, yes, this patient has respiratory alkalosis. Respiratory alkalosis. Because this agrees with this, we don't have to go and check the bicarbs. We can go and check bicarbs and see if there's compensation or if there's no compensation. But we're going to talk about those things. Compensation and all those things, right? So we leave those patients. Then we come to these patients. These two patients. We've got a patient. Patient number 1 has got an acidic pH with a partial pressure of CO2 that is more than 45. This one has got a partial pressure of CO2 that is less than 35. What is happening? So if we've got an acidic pH, let's look for a partial pressure that agrees with acidity. Which one is it? A partial pressure of CO2 that is less than 35 doesn't agree with acidity, but agrees with alkalinity. So this one is the one that agrees because the partial pressure of CO2 is more than 45 there. So we can say this is respiratory acidosis. And then for this one, because it doesn't agree, so by default, this is a metabolic acidosis. To confirm that, look at your bicarbs. Your bicarbs in this case should be very low. Should be very low. Guys, I think this is the best I can do explaining this. I don't want to over explain them. I want us to move on to the next section.